Everybody, my name is Toya. I am creating a new video today talking about bariatric surgery. Just to give you a little bit of breakdown about my situation, I am a Kaiser, patient or whatever with Kaiser in Georgia. So I did create a video discussing, like my process going through the Kaiser insurance for Georgia because all the ones that I saw was based out of, California, which I saw that certain things that they did a little bit differently. So, and then too, after COVID, things changed as far as their requirements or whatever. So that will be posted pretty soon. Well, as far as me, I am now 3 days away from my VSG surgery. Super excited. Telling you, it's been a long road, a lot of tears, a lot of frustration, a lot of worrying, but thank you, Jesus, it is here. So, with that being said, my starting weight was 240 pounds. So, right now I am, in the I'm in the clear liquid stage. I've already went through the full liquids as far as my pre-op requirements. So, I have to do is technically 3 days of clear liquids. I'm doing 4. Why? I don't know. Just trying to prove something to myself and it's kicking my butt. So, hey, what can you do? But all that being said, I just wanted to make sure that I am, mentally and physically prepared for, the road, the lifestyle change that is about to happen. So I wanted to make sure that, hey, if I feel like cheating or I feel like giving up, hey, maybe this isn't for me, but I'm hanging in strong because I really, really want this. Just to give you a few little stats, and I'm going to try not to make this video too long because I can be long-winded and I'm new to filming, so it's not going to be the most comfortable video. As you can tell, I didn't put on any makeup today. I just said, let me give the information, and as the time goes on, we'll glow up together. So how about that? But all that being said is my current weight is 240 pounds. Now, I didn't start off there when I first started this journey. I did have, a situation to happen that, I had gained a couple more pounds, but, the doctor's already aware of, what's going on. So at that time, my BMI was 35. Now, I did have a condition or whatever that, which was sleep apnea, that allowed me to proceed on with this, surgery, gastric surgery process. So that's pretty much how I started off. And right now, like I stated, I'm just waiting on going to the OR room. It's going to be at an Emory, hospital because Kaiser in Georgia uses Emory locations. Now, I will tell you one fun fact for Kaiser, patients that they didn't know, especially in the Atlanta area, is that Kaiser uses Emory's OR. They don't have their own. So a lot of the wait time is based off of the doctors being able to, the Kaiser doctors being able to schedule time to use the Emory, OR facilities, operating room facilities. So that is something that I did not know. In my process, I went through, nutrition classes. I had 3 2-hour nutrition classes, and I think that kind of took maybe, I want to say, 2 months or 2.5 months to go through all those classes. I also did my, behavioral therapy or behavioral modification at the same time. So, it kind of like didn't take additional time. So I was able to get both of those completed around the same time. So I got really lucky and blessed with that. My therapist already, we already had a relationship, a professional relationship with each other, and he was trained to counsel based off of bariatrics. And so it was just smooth sailing. So after that or whatever, I had to do some labs. Well, back after my orientation with Kaiser, I ended up doing some labs or whatever that they want you to do within 30 days. So I went ahead and jumped on that. So everything that I did in this process was pretty much, I just stayed on it. I did not, waste any time. If they asked for something, I did it. Now, the nutrition classes, those are 2 hour long classes. Everything that I've done thus far, minus, of course, going to the laboratory for, to submit my blood specimens, have been, telehealth. So that has been so convenient for me. Um, who wants to sit here and worry about trying to take off, missing PTO, leaving work early. So that really was a great benefit to me at that point. Um, I had with nutrition classes, I had, food logs that I had to log in, what I was eating for the week. Um, well, for about a couple of weeks or whatever, and then submit that. And then each time I had a nutrition class, I had to submit a new food log. I had to read a bariatric book. I had to go to a bariatric support group, and some of them were online, but I decided to go to the one that's, in person or whatever. I just kind of like being around people. That just gives me good energy, especially after the class is done. I can sit there and ask for, tips and advice, because a lot of the people there were pre-op, and some of them, well, I'm sorry, a lot of them were post-op and some of them were pre-op. So I got a chance to ask a lot of questions. And then with the support groups, I got free little, supplies like, bariatric calcium chews. So I was able to say, Celebrex or whatever makes a good one, or they don't. So it was a little freebie type little things, that I got a chance to, benefit at, by going to an in-person support group. So, one of the final stages or whatever I had to do was get an EGD. They just put a tube down my throat, looked at my anatomy or whatever between my esophagus and my stomach, made sure everything was okay to proceed safely with surgery. So after that, I spoke with the surgeon. Now the one thing I did not realize, I thought I was going to get a surgery date. So that didn't happen at my consultation with my surgeon. So, what happened was, once, I saw him, I was waiting on my surgery scheduler to give me a call. And he said, well, the paperwork said if the surgery scheduler does not give you a call within 2 weeks, give them a call. Well, my impatient self did not wait. So I went ahead and called after a week. There was a lot of wait time. That was February when I finally, the first, I think, first or second or third of February, and now it's April 27th is when I'm getting my surgery, and that's 3 days away. So it's technically, I think, April 24th, if I'm saying it right. But anywho's, but it's 3 days away. So um it took a long time, and one thing that I did do was ask to put myself on call. So if somebody canceled, or for whatever reason they could not take that date or whatever, I was on standby. So um I thought that that would kind of work better in my situation, but yes and no. Standby did not push me ahead of everybody else, because the group that went before me still had to go, but whoever like was in the group before me or whatever, or that group that I was in, if they, got done with their stuff a little bit earlier, then they were next in line. So luckily, fortunately for me, I did have someone that could not take the date, and I was told that my surgery was supposed to be the first week of May, and then they had some scheduling issues where they said it was going to be the second week of May, like second or third week, so probably about May 17th or May 18th. So I was getting a little discouraged at that point, because I literally had to make a lot of arrangements with my life or whatever, and I needed to get this surgery ASAP. So that's just what it was. So luckily, prayerfully, thank God, I give Jesus Christ all the praise and glory. He made that happen sooner than what I was anticipating. So, anybody getting this process done, please, I'm telling you, I can't emphasize this enough, to please have patience. My journey total time is 8 months. So, if your plan states or whatever 4 to 12 months, yeah, it's a lot. It's a lot. I'm not even gonna lie, whatever. I thought realistically at that time I would have been having my surgery in about maybe the end of February. Doesn't always work like that, especially if you have an insurance that has to use another hospital's OR. But other than that, Kaiser's great. I have no issues. They made it super easy. They've held my hand throughout this whole process. The scheduler, bariatric coordinator, everybody has been super magnificent. So no complaints on that. It's just the time part. So anywho, a little bit nervous. Energy is drained right now. I'm just ready to get this process over with. My mother is going to have to come from out of state in order to take care of me. So, it took a lot of getting her schedule with my schedule, kind of coordinated. But God worked it out, so we're all good. If you have any questions or any concerns, this is my first video, so as I'm filming, you'll see the process or whatever, in the journey that I'm going on. You'll see my body, face, everything slimmed down, so that will be a wonderful thing for you guys to go through this journey. If you have any questions, please let me know. I forgot to mention that I am a nurse. So I can kind of help answer a little bit more in depth, but certain questions is going to be based off of, what your plan, states, and what your surgeon, pretty much will and will not do. Not everybody, everything is not atypical. So thank you. Please subscribe to my channel, and let's go through this journey together. I look forward to, putting out more content for you guys. I am going to try to send or put out a video the day that I do have surgery, if my daughter can attend with my mother. So she will be able to show you guys the process, how I feel, just pretty much everything. So, we'll go through this together. I think this will be a good thing for you and me. So, hey, why not? So, thank you so much. Talk to you soon. Bye.